One is the challenge of the ecosystem, coming back to that, is the collaboration amongst the different silos. And the collaboration amongst the other human services sector organization, whether it's disability, aged care, mental health, was happening in a collaborative space. And I don't want to go back and say that that was good and this is bad. What I'm trying to understand is, or I want you to suggest, how do we go from here to bring that, not just collaboration within the government departments, but the collaboration across these silos of our not-for-profits and charities and for-profit organizations coming together for the single goal of delivering a holistic support?
Yeah, absolutely. I know that we are facing some similar workforce challenges across aged care, disability care, healthcare, and early childhood education as well. We are facing some similarities in those challenges, and there are definitely things we could do to make that work a little more smoothly. But if we're always coming back to putting the person back in the centre and listening to what are their needs, I think that will help us to find that way through.
I would want to go people online in the room. There's a question by Andrew Thomas. And there are 6 likes on the top, and that's how we prioritize. So the question for you, the Minister. He says, as the Minister of Mental Health, how do you see early intervention can or should work for mental health, psychosocial, pre-diagnosis for NDIS funding?
Yeah, that is a really good question. Being both the Mental Health Minister and the Disability Minister, I can't help but think of both of things together. We have a real focus in the ACT on trying to roll out more and more early intervention and prevention services for mental health. And that means delivering more care closer to where people live in the community rather than shifting that focus into inpatient services in hospital. If we can provide better care to people in the community, and if we can recognise that mental health is not something, it often works in cycles where things might be going really well for a while, and then you might need a little bit of extra support, and then you might find that your support needs reduce again, and it's not always easily predictable either. If we can recognise that there is that need for flexibility in what levels of access people need to support, that helps enormously. I'm also very hopeful at the moment that because we've got governments around the country and at the national level all talking about the difficulties we're facing in our fragmented health system between primary care, acute care and care for chronic conditions, and that includes psychosocial mental health conditions, that we're in a moment where we could actually make some changes that fundamentally shift things and help to connect those things up again. That is my hope. We've been rolling out things like residential step-up, step-down services in the, which means that if someone realises that they need more care than just, say, seeing their psychologist or going to their group therapy programs is able to give them, but they're not yet at the point where they need an inpatient stay in hospital, that there is somewhere else that they can go that's in between, where they can still work on their recovery, but without going back into the hospital environment. And having more and more options for things that are supporting people at an earlier stage is definitely helping. We're seeing the impact.
Thank you. Thanks for sharing.